For the anterior musculotendinous structures of the hip and pelvis, we're going to have the patient in supine, but what we call the supine hook lying position. This is known as the hook lying position in supine. And our obvious bony landmark is going to be the ASIS. So we find the ASIS, and from that point, we are going to go just distal, just off that ASIS. And with her legs in hook lying position, this keeps all of these abdominals and all the hip flexors on slack and relaxed, so nothing else gets in the way. The motion I'm going to have her do is just to simply unweight her leg. She doesn't have to move it very far, but just simply unweight the leg. And the first muscle that comes directly off of the ASIS is the sartorius. Now, the sartorius is known as the Faber muscle, but we are actually going to be testing just the F part of it, which is flexion of the hip. So I'm going to have you lift up, and I can feel the very, very proximal end of the sartorius, and it's a strap-like muscle. Go ahead and lift up, and I feel it, and up, and I'm strumming it, up, and I'm strumming it. The next muscle is going to be deeper and just medial to that, and that's also going to be another hip flexor, and that is going to be the rectus femoris. Now this one is difficult to palpate, especially if you're a beginner, but hang in there and give it your best shot. So you're going to go just medial to that, and you're going to feel more of a tendinous structure, and that's the tendon that actually attaches the straight head that attaches to the AIIS, or the anterior inferior iliac spine. And we're going to do that because it is also a primary hip flexor, so we're going to have them unweight their leg. And you know you're not on the sartorius because you just came off of the sartorius from the previous palpation. So go ahead and lift up, and it's a tendinous-like structure. Up, and a tendinous-like structure, and up, and a tendinous-like structure. From that point, our third muscle in a row, going medial, we are going to go medial to that, and this one is going to be a larger, flatter muscle, beefier muscle, and it is a hip flexor. It is actually two muscles as they come together past or below the inguinal ligament, so we stay below the inguinal ligament, and we are palpating just medial to the rectus femoris, and we're palpating deep, and is a beefy, flatter muscle, and this is what we call part of the iliacus and psoas major that come together to form the iliopsoas muscle. So I'm going to have you lift your leg up, and it's a flat, beefier muscle. Do you feel that? Lift up, flat, beefier muscle. Lift up, flat, beefier muscle. Good. And then the next group of muscles will be the adductors. Now, only two of the adductors are palpable in this position, the adductor longus and the adductor magnus. If you remember from anatomy, the adductor brevis is actually deep underneath the adductor magnus and adductor longus. So we are going to go basically mid-thigh is going to be our landmark, mid-thigh for the adductor longus. And the motion you're going to be having the patient do is adduction. Now, all you're going to do is resist that motion for the patient. Don't let me move your leg, and then you're going to palpate the adductor. And this is the adductor longus, the adductor longus. Don't let me move you, and then I strum it. Relax, don't let me move you, and then we strum it. Now, this is much more anterior than you expect it to be, so don't be trying to reach behind the leg. Mid-shaft of the femur, more anterior than posterior, resist adduction. The adductor magnus, we are going to palpate all the way down to where it actually attaches to the adductor tubercle. Now, we have not palpated the adductor tubercle yet, but we will at the knee. That's basically about, palpation is going to be about 3 fingers width above the medial epicondyle of the femur. If you're about 3 fingers above, then that's where you're going to put your palpation fingers, and then you're going to resist adduction. And then it's going to be a much more tendinous-like structure. Don't let me move you, and relax. Don't let me move you, and relax. Don't let me move you, and relax. Don't let me move you, and relax.